Suicide is a serious public health concern in the United States that disproportionately affects military veterans.
It's determined that there's about 25 veteran suicides per day, and that is an unacceptable number. As a clinician, when I'm walking in the exam room to see a patient, I'm really only seeing the patient's data that's currently in the electronic health record system. What other data elements could be brought into the decision-making process by using capabilities like AI and natural language processing? It's going to truly influence that decision in the exam room.
As part of the Department of Veterans Affairs' Mission Daybreak, Guidehouse teamed up with Red Hat and a group of clinicians and therapists to bring the data together. Building an AI solution on top of Red Hat OpenShift, the team used containers to quickly deploy and snap together models that could be published back into the electronic health record system.
We actually had a live model within days. It was stunning. So imagine patient's record is handed over to a orchestrated set of models, which include the original clinical model that VA put together, and then 3 other models. And there's an orchestrator that sits there and says, does anybody here have anything smart to say?
An alert pops up. Based on these elements in their data, this patient scored a high risk for suicide ideation. Oh, also, since they live in this specific county, they're more at risk of housing and food insecurity.
And that all happens, like within a picosecond.
And this is just a single use case.
So you start to reimagine what that interaction in that exam room looks like with your provider. What other data sources can be brought in to help? Hypertension, obesity, diabetes, the key conditions that are kind of plaguing our society today. So even though we started out with really working to end veteran suicide, the solution that we developed can really be expanded to actually address some of the most pressing healthcare issues nationally.
Want to learn more about Red Hat AI solutions? Click the link to check it out.